then the food and chemical sensitivities. Now they're a lot of work. You have to take a very careful history there and figure out what foods they're sensitive to. Some of the tips are that what a person craves, they may very much crave the very food they're sensitive to, or quite obviously, if they know that they're have a bad reaction to a food, you can't do that anymore. Sugars, they're not allergic to sugars, they're allergic to what grows on sugar and allergic to the nutritional deficit induced by sugar. So sugar is just forbidden for all of these allergic people, you see. Not that, and so the other thing about that is that so the test will not show that they're allergic to sugar, but you got to stop it anyway. And then there are just food sensitivities that are just flat out poisons. It's like if you ate arsenic and died, you wouldn't say you were allergic to arsenic. And that seems to be like with the nightshades. There's a toxin like in potatoes called solanine, which is first cousin to atropine and scopolamine. So tomatoes, potatoes, eggplant, red and green pepper, paprika, and tobacco don't necessarily show up on any allergy tests, but they will cause reaction. So as I say, working up food and chemical sensitivities is a lot of work, but history is the most important thing. For the chemicals, you have to ask them about, are they better at work or at home, or and if they go on vacation, are they better? You start worrying about things like molds in the houses. You worry about gas in the houses, on the jobs. You think about chemicals. I've had people allergic to their computers. The outgassing of chemicals from their computers. And now, as far as chemical sensitivities are concerned, massive doses of ascorbate will take the edge off of a lot of them so that they become functional. But still, it's not perfect. And although we've had people with chemical sensitivities become 80–90% better, I still want them to avoid those allergic reactions.